So really fortunate to have with us this amazing group of people, and I'm just going to introduce them one at a time. Derek Sueki. Dr. Sueki presently holds the position of a director on the board of directors for the Academy. Alongside Beth Collier, he has been entrusted with the responsibility of leading the Academy in the realm of diversity, equity, and inclusion. Apart from being a clinician and academic, he is the owner of 2 private practices located in Southern California and holds the role of program director for the Doctor of Physical Therapy program at Azusa Pacific. So thank you very much, Derek, for joining us. And Derek is, being a little humble, he's actually the chair of the AOPT. He's been recently appointed as the chair of the AOPT Diversity, Equity, Inclusion Committee. So next, I'd like to introduce Carmon Elliot. Carmon serves a dual role as executive director of the Physical Therapy Fund and vice president of DEI for the American Physical Therapy Association. She serves as the association's member-facing DEI thought leader, serving as senior leadership to cultivate and champion a diverse, equitable, and inclusive member experience. As vice president of DEI and executive director of the PT Fund, Carmon is the staff liaison to the Board of Directors DEI Committee and the PT Fund Board of Trustees. She administers the fund, creates a strategy for increasing donations, and participates in fundraising efforts. So Carmon, thank you so much for joining us and being with us. Next, somebody who I've known for a very long time and really value our relationship and appreciate her willingness to be here is Dr. Kim Nixon-Cave, who's a professor and program director for the hybrid DPT program at the University of Pittsburgh. Currently serves on the APTA Board of Directors. Her record of scholarship, publications, and presentations has focused on clinical decision-making and clinical reasoning with a focus on addressing the biopsychosocial factors and social determinants of health for a diverse patient population, as well as educational program and curriculum development, all to develop reflective practitioners and considerations of social justice, diversity, equity, and inclusion. So last but not least is a close friend of mine, mentor of mine, and somebody who's been very special for me in my professional growth and development over the years. Rob Tillman is the president of Author Rehab and Specialty Centers in Arkansas. Rob completed a postgraduate residency training program with the Ola Grimsby Institute back a long, long time ago. Rob currently serves on the AOPT payment work group, and perhaps most importantly, he is the president of the American Academy of Physical Therapy, AAPT. And I want to read this mission statement from the AAPT for those of you who may not be as familiar with this organization. The American Academy of Physical Therapy is a not-for-profit organization whose mission is to provide relief to poor and disadvantaged African Americans and other minorities by promoting new and innovative programs in health promotion, health delivery systems, and disease prevention, by encouraging minority students to pursue careers in allied health professions, and performing clinical research directly related to health conditions found within minority communities. So again, so thankful to have this
Who wants to be late? It's 7:09.
group,
Did you call her?
expert panel. What I guess I would ask if you guys could mute your audio so we're not getting the background noise. And just so you understand the flow, we're going to start off with hearing some words from each of the panel members. We'll start with Carmon Elliot and Kim Nixon-Cave, and then we'll have Rob Tillman share a few words with us, and then we'll have Derek provide a few comments, and then we'll really open it up to an open forum. And that's for us, in the past has been some of the best parts of the virtual town hall. Besides the brilliant presentations from the presenters, the questions and the conversation that takes place. So we encourage you to just hold your questions though until we get to that point. So thank you very much. So I'm going to turn it over now to Carmon and Kim, and they have a few slides that they're going to go through here.
Great, thanks so much, Bob. It is a pleasure being in the Zoom room tonight with the Academy of Orthopedic Physical Therapy. I'm looking forward to the dialogue and the conversation on this evening. So Kim and I are just going to go through a few slides that we have here just to provide a high-level overview of what APTA is doing, specifically in the diversity, equity, and inclusion space. And I will say that this is not everything that we do. We do so much more, but we just want to provide, again, a high-level overview of what we're doing in this space. So Bob, if you could take me to the next slide, just to provide a quick overview of our journey and what we like to call building a community in diversity, equity, and inclusion. Really, it begins with our mission and vision and our strategic priority of the association. It has been for a while now and probably really picked up momentum, right, in 2016 when our current president at the time, Dr. Sharon Dunn, was focused on the 7 bold moves of what she wanted to achieve within our next 100 years of the association. So it was really to make APTA an inclusive organization that reflects the society of the profession that we serve. So we are transforming society, which is our vision. We are building a community, which is our mission through various efforts. And we really like to have our work fall under 4 themes here. One being develop, because we want to develop the profession. We want to learn from each other. We want to engage, create communities or networks so that our members do feel that they belong. And because we are the professional home to the physical therapy profession. So we want to be able to build a sense of engagement, of belonging, and we want to take action, which is really important. So here on the slide are a few things that we are doing, a few efforts that we have embarked upon. One being PT Moves Me, which is our student recruitment arm. There, we want to spend time increasing awareness of the physical therapy profession. We want to recruit the next generation of physical therapists as students, and we also want to increase diversity within our applicant pool. So the PT Moves Me program has been around probably a little bit before the pandemic struck. It then really picked up momentum over the last few years. Right now, we have over 400 ambassadors who are part of this program, members of the association. We have 1 clinic ambassador. So the American Academy of Physical Therapy, Rob's group, is also part of this program. And again, it's all about recruiting students into the field, bringing awareness and increasing diversity within our applicant pool. We have 72 chapter ambassadors who are currently signed up as part of this program. And what we do is just provide all the tools and resources for our components to go out into the field, our education ambassadors to go out into the field and provide information about the profession. We have resources as far down as elementary school available so that when you are in your communities, you can reach out to students who may be interested in coming into the profession. We also have our DEI committee, which provides general counsel, advice, guidance to our board of directors. They are a board appointed group to our APTA board. Again, they provide guidance and advice and counsel. One of the latest pieces that they did provide was the American Medical Association guide to health equity that we shared with the House of Delegates. So we ensure that we all are speaking from the same terms or the same language. So they provide guidance such as that. They also give us information on how we want to ensure that our meetings and our events are inclusive meeting and events. They are also the ones who have really came up with the themes for our DEI action plan, which I'm going to talk about in just a moment. Our PT Fund, Dr. Kim Nixon-Cave is the president of our PT Fund. As you know, the PT Fund have been around for, 20 plus years, probably again gained momentum over the last couple of years, simply because now we have a separate board of trustees that govern the PT Fund. We have provided over $1 million in scholarships to students over the years, and we anticipate that this fund will continue to grow. Not only do we have the Minority Scholarship Fund under the PT Fund, but we also have a new fund called Dimensions of Diversity Fund, which actually provides scholarship dollars to students who identify as first generational students, students who identify as LGBTQ, students with disabilities, and also any one of our members or non-members who are providing DEI programming, we also support as well. We also looking at ways to advance the practice, right? So we have the DEI certificate program. If you have not taken a look at that, please do. It's in our learning center, but it's a great opportunity to advance the practice, through the DEI lens. You actually participate in 6 courses, you get a DEI certificate. We also have our resource that we provide for our components. If you are starting a DEI chapter level, we also provide resources on how to start your DEI chapter at the local level and what you need to consider to get members involved. We also have the DEI toolkit, which was created by our student assembly about a year ago. So that's also available. It provides definitions of various terms. It provides guidance. It provides resources on different affinity groups you can reach out to as well. We also have our partnerships. We have partnered with Special Olympics and other groups as well. We have AAPT, who we have partnered with on specific initiatives. We have other groups that we are partnering with as well. And then the last piece here is advocacy. And we think this is a really important arm of what we do in the DEI space. We recently, of course, signed on with AOTA and ASHA on how we increase workforce diversity within our professions, similar to what the nurses and the dentists are doing. So we want to be sure that we are increasing, again, diversity within our field as well. So, and there are other advocacy things that we are moving toward within next year. So specific to our components, I want to turn it over to Kim so she could talk a bit about what ACAP is doing in this space. And again, using them as a great example of how they are increasing awareness of diversity, equity, and inclusion specific to the profession of physical therapy. Kim?
Okay, thank you. Bob, you can go to the next slide. But before we talk about ACAP, I want to talk about the PT fund and give a little more detail about how that fund is partnering with the DEI committee to provide financial support, because the PT fund is about raising money for the initiatives related to DEI. So we're partnering with the DEI committee to support activities and programs that they're looking at. We're also looking to partner with components, academies, to really support their efforts through financial means. And that's where the dimensions of diversity comes in, and there'll be more information coming out about that. But I think it's a great opportunity to really have DEI threaded throughout the association, as opposed to having a little bit here and a little bit there. Our goal at the PT fund is to make sure to use the money that we're raising that's coming in to really have a major impact on DEI throughout the whole association. One of those partnership is with ACAP. ACAP over the last year, and I know some of you that are on this town hall were at the summit. One of the goals of ACAP was they develop a commission to look at DEI issues and from the education perspective. And we had the opportunity to develop this summit. And one of the goals of the summit was to bring everyone together. Instead of everyone working in silos, to bring everyone together to talk about how we can impact DEI. And as I said, it was really from education. But what we found as we developed the summit, it really led from pre-PT all the way to post-professional PT. So there is a proceeding that's out there. And if you haven't seen it, it really lays out what we found. This is ongoing work. One of the things that we didn't want from the summit was recommendations. We wanted actions. So there are groups that are still working through ACAP to really develop and come up with action items to really have an impact on DEI. And the whole theme is to really develop opportunities by building partnership and creating space and opportunities for people from underrepresented groups. Next slide. Carmen.
Great, thanks, Kim.
Mm-hmm.
So I would reiterate to what Kim just said about this being ongoing work, right? So again, DEI is it's an evolution, it's ongoing work, it doesn't stop. So I think that's important to note, and especially to note that it requires action. So one piece of that is in our strategic plan, our 3-year strategic plan here, while DEI specifically falls under member value, it's also important to note that it's really threaded throughout everything that we do. So we just don't look at DEI as a lane, it's a lens. So everything we do is viewed from the DEI lens. One piece of that is, as I mentioned earlier, about the DEI committee crafting the DEI action plan, which is one of our operational documents that helps support our strategic plan. Bob, if you take me to the next slide, is the DEI action plan. So this will be published within the next month. It is going to go before the board of directors one more time before it's actually released. The board approved the themes and the concepts back in November of 2022. And then since then it has gone through a few iterations, and then we'll go back for our board this month, the month of June, and then will be published definitely before the Leadership Congress. But the DEI action plan, and just want to talk about this really quickly, and then we can move on to the next speaker. We have great speakers behind us, but it really has 3 themes to it. One is allyship and advocacy. And the goal here is where we will seek micro-volunteering opportunities and prioritize recruitment, retention, and engagement from historically marginalized population. If anything, what we have heard in feedback is that perhaps serving on the board, such as 3 years, may be a lofty lift for some people, but they want to be able to have micro-volunteering opportunities to, again, demonstrate their leadership abilities. So we are evaluating that and how we could actually leverage micro-volunteering opportunities. And also on the piece of advocacy, we're looking at ways how we could continue to coalesce around other groups as well to help support DEI efforts. For example, we recently signed on with a group that we are in with 19 other health professional associations, where we did recognize academic freedom. And we think that's really important to us as we see quite a few bills crossing the nation right now. Leadership and growth and development is another piece that we are looking at. And really, we're looking at how we can develop a training academy for historically marginalized populations. So this will be a heavy lift for us, right? So developing Leadership Academy, but we anticipate bringing expert advice into helping us to build that out. The last piece here is conscious inclusion. Really, the goal of this is to design tools and means to listen and learn for a variety of voices. That way we can collect data to help inform our current and future initiatives. So this is really important for us too. And this will look like perhaps holding town halls and holding meeting sessions, listening sessions, and things of that nature. So the DEI action plan under those 3 themes will all have activities under each one so that we can all coalesce around to, again, to Kim's point, now we have something to act upon. So that's the overall goal of the DEI action plan. And again, it should be published within the next month. The first rollout will go to our components first, our leadership first, and then it will roll out to members following that, also to our affinity groups as well. And the last point I will make is that our next steps that we are looking into is looking at our sexual orientation, gender identity data. Right now, we do not collect that information, but we are looking at how we can increase our capacity as far as collecting data demographics and looking at sexual orientation, gender identity, so we can better serve those who identify in those communities, so we could also be able to create and form our resources and better initiate efforts with our extended community as well. We're also looking at member engagement groups. So this is something that we will be introducing this year, leading into next year, on how we can create networks with our affinity groups as well. And then also, last piece I'll mention, of course, publication of the DEI action plan, which we will execute really soon and start rallying around that as well. So I will stop right there, Bob, and you can move on to the next person, but Kim and I are definitely around if anyone have any questions.
Thank you so much, Carmen and Kim. I'm going to stop sharing for a second and bring us back off of the slide deck for a second. And our next speaker is Rob Tillman. And so Rob, let's love to hear, from you, from your perspective, what is, going on in your world, relative to your current position. And then I'll just let you go. So thanks.
Great.
Thanks for being here.
I certainly appreciate being here and being a part of this and being a part of the dialogue. And hopefully I can lend some positive thoughts and interactions toward the goals that we have in the Academy of Orthopedic Physical Therapy. Someone asked me a question once. They asked me what the American Academy of Physical Therapy was doing for DEI. And the entirety of our existence is based upon concepts of DEI before it was called DEI. It was called things like affirmative action and things like that back then. And a point that I'd like to talk about as we get into this is now DEI is being vilified by certain political groups. And we just have to stay true to the things that we believe in. And I think that terms like DEI and affirmative action all fall under the concept of just being fair and inclusive. And if we keep it simple and show that we have thick skin and can take a punch, we can press forward with the things that we all believe are important. I wear several hats. The most important one when it comes to this topic is president of the American Academy of Physical Therapy. But I'm also on the Arkansas State Board of Physical Therapy and have been for the past 20 years. I got on that board because a witch hunt that was happening to manual therapists by the chiropractors, and that's just a totally different thing to discuss at a different point with various other organizations. But one thing that we're able to get done with the Arkansas State Board is a lot about $250,000. Through legislation that was just passed over the past couple of months to deal with situations of increasing awareness and education in physical therapy in underserved communities. So we're trying to make sure that there's appropriate representation and diversity in the committee that'll be allocating those funds and putting action plans together. So that's something that really is important that we're able to get done in the state of Arkansas. And I'd like to be able to create a template to where we could possibly replicate that in other states, which brings me to another point. To be able to do broad-based replication, we have to have overlying redundancy with other organizations. We work with the APTA in several ways with a memorandum of understanding. I have really enjoyed my engagement with Carmon Elliot and then President Sharon Dunn, and I share a good relationship with the current president, Roger Herr, as we work together with things. Though the American Academy of Physical Therapy was born out of the APTA, we have never separated from the APTA. We have all maintained engagement to a large extent, or at least most of us have. And we are at a point now that we have better coordination of objectives and activities than we ever have. Including our participation with activities like PT Moves Me and things like that. It doesn't make sense for there to be replication of activities when we can have coordination of activities to really push forward the goals that our profession has collectively. And I do believe that if we all work together, and if anybody can work together, it's a bunch of PTs. I just think that physical therapists are special people in general. I love being a PT and I love engaging in things like this. And I'll try to always find time when I'm asked to engage in things like this. But we all have overlapping loops in our organizations. And I certainly appreciate being included in several different realms on several different committees and Zoom calls and think tanks and things like that. It's just one way that I think I can give back in serving, because I've been doing this for so long. We have a lot of different programs within the Academy for mentorship and navigation. We have the Woody Academy, which is something designed to push forward the beliefs and philosophy of Dr. Linda Woodruff, a leveling up initiative to where students that are from inherently underserved communities are exposed to different aspects of healthcare. My wife, Rhonda, is a breast cancer surgeon, and she did a Zoom call for the Leveling Up initiative on surgical oncology. And just being open-minded and working with folks and being thick-skinned on things in this world where everybody is so hypersensitive. I think that if we just take a step back and understand that different people are at different levels of engagement and enlightenment when it comes to fairness, or if we call it diversity, equity, and inclusion, or affirmative action. Not everybody who's not fully engaged is totally against people. So, and I've learned that over the years. And I have learned that I have got to give people room to grow and room to engage without being judgmental or trying to, condemn anyone. If they're just simply not there, they simply don't understand. Because what happens with that is you take somebody who has the potential of contributing, or at least developing and growing in their thought process and being able to include other people that aren't quite like them in employment or in school situations or in think tanks and work groups. If we don't soften it up a little bit as a society, I think that we're hampering America's potential as we press forward. And no matter what, if we push forward on things and change to change things, there's always a pushback. With the emancipation from slavery to women's rights in voting, to the Civil Rights Initiative, to everything, to having a Black president. There's a push forward and there's always a push back. And sometimes the trade winds carry us forward a little bit more aggressively than other times. But I do think that the things that we're doing now in the engagement with the American Academy of Physical Therapy, with the APTA, has been sustained long enough to where this thing's going to keep going. And the various other aspects of the APTA, like the Orthopedic Academy that Dr. Rose, president of. So I am as optimistic now as I've ever been, even though the political climate in America is just absolutely crazy. I feel good about our engagement, and we're here to help. We're not new to this. We're true to this, and we'll keep a handout in engagement and an open mind, and we'll just keep making our contributions as we can, as we all try to move things forward.
Rob, thank you so much. Really appreciate your words of wisdom, and I think there's a great message in there for all of us. So thank you. Our next member of the expert panel that we've put together here for tonight is Dr. Derek Sueki. Derek, as I mentioned, is a member of the AOPT Board of Directors, and he's currently chair of the AOPT Diversity, Equity, Inclusion Committee. So thank you very much for being here, Derek.
No problem. Thanks for having me. I'm really excited and thankful to be a part of this panel and to be helping AOPT in the space of DEI. You know, DEI has been important to me for a long time, but even more important, it's important to the Academy. And so I'm going to share just a little bit about where we're at and where we've been in terms of the Academy, so you kind of get a framework of where we're headed. And I'm going to keep it fairly short because I want to give plenty of time for you guys to help us figure out where we need to go as well. So I just have a couple talking points. You know, I rolled onto the board of directors about 3 years ago. And when I rolled on, I was tasked at the very beginning with Lori Michener to be a champion for DEI in the Academy, which was a great opportunity for me and for the Academy. So as we moved forward, we realized that there was a couple of things that we needed. It was actually one of the strategic goals for the Academy back 3 years ago. And so as one of the strategic goals, we realized that we were really starting from fairly ground zero, and we needed to even define what diversity, equity, inclusion was. So about 3 years ago, we started that process of defining what diversity, equity, inclusion was for the Academy. And we assembled a group of workers, a work group headed by Stephanie DeSassi and Tricia Perry. And I think I see a couple of names in the chat room who helped and did amazing work as well. I think Rosie's there and Annette's there and Kimmy's there, and they all helped serve on the work group to help us first define diversity, and then we moved on to equity inclusion. And so by the end of the first year, we had those definitions in place. You know, after that, it kind of hit a little stagnation point from the standpoint that, you know, we had the work committee ready to do things, and it wasn't from a lack of issues or a lack of things that need to be done in the DEI space for the Academy. It was more from a lack of direction, I think, from just trying to figure out where we needed to go and what direction we needed to go in terms of DEI. And so over the next year, we tried to figure out what the best strategy for us. And just recently, over the past 6 months, we made some significant progress in DEI for the board. In March at the CSM, or in February at the CSM meeting, the board of directors voted to make DEI really a significant priority within the Academy. And they did that not only by designating personnel, but designating money to this process. And by doing that, what they did is we voted as a board to create a work group, and actually not just a work group, but create a committee that would sit on the board. And so they elected me, or they nominated me or appointed me to be the director of DEI. And we actually created a committee that stands on the board, similar to practice, similar to research. We now have a DEI committee, and that DEI committee is not only headed by me, but we also have a second board member designated to DEI as well, and that's Beth Collier. And together, Beth and I are tasked with keeping DEI on the forefront of the Academy. And so we will have board representation. We have 2 members pushing forward on anything that we need to get moving forward. And not only that, they designated money in the form of the fact that we realize that if we have board membership, if we have board leadership, we still need people to help us get those things done. And a lot of times we rely on the volunteers, which is amazing that we have a great pool of volunteers to help us. But the challenge is that sometimes with volunteers, they need direction too, and they need a staff person. And so starting 2024, we have voted to bring on a staff person onto the Academy that will be designated to work on DEI related tasks. And so that's a significant step forward, because not only are we saying that we need help and we're going to designate and work to it, but we're designating money to this and people and resources. And so for us, now that we have that structure in place, we have 2 directors, and we also have a staff person assigned to DEI related activities. Now we need the direction. And so over the next couple months, Beth, myself, and the board were putting together a structure similar to some of the other committees that we have that take a look at some of the main things. And we don't know what the structure is going to look like. We have some ideas of things like we need something that'll look at membership. We need DEI in practice. And so these are topics that we will have as subcommittees that are being oversawn by Beth and myself. And then from these subcommittees, we'll be tasked with different projects and works and creative ideas, and to help us to grow and move forward as an Academy. One of the other things that we know we need to work on in the next several months is to start to develop a strategic action plan as well, because this action plan will help us figure out where our priorities are and how to get there. So over the next 6 months, I think you're going to see some significant changes and significant growth and movement forward. the movement forward will take place in terms of the structure, to the practice committee or the DEI committee, and then as well as a strategic action plan moving forward as well. But we're at the beginning of this process and we're moving forward, and we're really looking forward to this town hall meeting as a chance to give you, the members, a chance to help inform us on where you think we should be going as well, and topics that we should be looking for. You know, this is where we're at, and this is kind of where we're headed. And I think talking to Bob earlier and in several meetings in the past, I know that we want to give you guys plenty of time to help inform us of directions we want to go. So, you know, I said I was going to keep it short, and so that's about all I had to say, Bob, and where we're at, where we're going. And so, you know, I was going to turn it back over to you to lead the session on where to go.
Thank you so much, Derek. Appreciate your efforts and leadership within the Academy on this. So great job. So the next portion of our town hall is now open mic, and we, as Derek stated, you know, we're happy to if you have questions for the panel, that would be great. Or if you have, you know, feedback or ideas, suggestions for the board, the AOPT board, we're certainly welcoming that and would love to hear that. So it's what I would ask is just look for your reaction, the little tab for reactions, and use your hand raise feature so that I can see who's in the queue to either make a statement or ask a question. So there you go. Dawn, thank you so much for jumping in and being the first one. Sometimes for some people that's really easy. For some people it's hard, but either way, I really appreciate you jumping in and getting into the queue. So thank you.
I'm putting myself out there. Why not?
Yep.
Good evening, everybody. And I appreciate the panelists and what was said earlier. And I have a question specifically directed for Derek. And I'm going to echo something that Rob Tillman said earlier when he said, you know, give people room to grow in the DEI space. And that applies to organizations and the academies as well. And I know I just looked at or re-reviewed the strategic framework from 2021, 2024, and it says for diversity and inclusion, it says increase the diversity of members and leaders and engage in efforts to make AOPT a more inclusive organization. And I know that, you know, you're asking for some feedback as far as how to go about that. I guess I have two questions. One is that when this DEI committee was formed, what did the members say of the Academy of Orthopedics? What did they say as far as what they wanted the committee to be charged with? And to date, what kind of things is the Academy doing to actualize that strategic plan with regards to, you know, diversifying leaders, engaging more, increasing representation?
No, those are great questions, Don. Thanks for putting those out. You know, when we talk about committee, let me define a couple things. One is we had a work group that was originally formed in the past, and they're the ones that helped us develop our definitions and helped get us started in the direction. And now we have an actual committee that's formed. And when I talk about actual committee, that's being a little bit broad, because the actual committee at this point is me and Beth. And because it's just been formed 2 months ago. And so we're looking for your guidance on things like, what do you guys think should be included in the committee? What do you think should be the primary focuses on that? And we're hoping to get your feedback, because we're just at the beginning of forming this. And so I'm very grateful for you stepping out and asking. And it really is a nice segue into our request to say, well, what do you guys need? What do you guys think should be the areas we focus on? Because the committee, like I said, it's a committee of 2 right now.
And I'll add on to Derek's response that we are wanting to go full bore ahead on developing this. But the other thing we wanted to do is and we didn't want it to be a something that was, you know, preventing us from moving forward, but we were really curious to see what APTA was creating. And so we heard, you know, tonight, you know, from Carmon and Kim about, you know, the initiatives going on there and the action plan that APTA has created. And we were waiting for them to release it to form, to give us a formal release of that, and because we feel like there's some things that we're going to do in collaboration with APTA, and we wanted to know what they're doing so we can do in collaboration, and then clearly there's going to be things that that are going to be unique to us and some nuances that'll be different for us that we'll want to create on our own. And so we really wanted to see what APTA was going to come up with first and see where they were going to help give us some direction as well. So I hope that helps to answer some of that. So thank you very much for the question, Dawn. And
Don, do you have any thoughts on things we should prioritize?
Well, yes and no, because part of why I asked that question, I know many entities create DEI committees or task force, et cetera, because they know it's the right thing to do, if you will, but not necessarily polling the invested parties or who's going to be affected to say, what do you need? And I know that this is relatively new and you're asking for suggestions, et cetera. I don't know if down the line you all will send out like a member survey or something to say, hey, what do you all think the issues are as it relates to DEI, whether it's when we think about diversity, is it a specific aspect of diversity that you're focusing on? Is it the entirety of diversity? Where are the gaps? What do you see that's needed, whether it be like you have in your strategic plan? Is it leadership? Is it, what's published in the journals that needs to be more inclusive with regards to authors, acceptances, et cetera? Like, what is it exactly? What are the gaps that are there? So yes, I have suggestions, but suggestions aren't necessarily beneficial unless I know where the gaps are or what needs to be tackled and what needs to be prioritized with regards to the overarching DEI.
No, those are great thoughts. And, thoughts of things like a survey and polling of the membership is a great idea. And at this point, a lot of things are on the table. I mean, nothing is really off the table at this point. So we'll make note of that, Don. So thank you. And then Albert.
Good evening. Thanks so much for being on the call. I am fairly new to DI, so I appreciate the information that the speakers have provided this evening. My question is, how does the DEI engage like the newer graduates who are just getting out of school and just trying to figure things out, and what's the opportunity there, and what's the challenge?
Albert, are you directing that to a specific panel member or just open to the panel?
Just open to the panel.
Okay. So would anybody like to jump in and answer that?
Bob, if you don't mind, I'll take a swing at
great.
it. Albert, is it?
Yep.
Okay, Albert. Breaking the inertia of engagement is important. If you simply just, send an email to the leadership in whatever aspect of whatever hoop you're looking at, whether it's this academy or the American Academy of Physical Therapy, the APTA in general, I'm sure that Carmon Elliot will be able to walk you through some of the things that are going on so that you can find something that you may want to engage in. It could be something like the PT Moves Me program that may have a little bit more of a bend in your community if you talk to an underserved junior high or high school or elementary school about what our profession is, and give some hope to a young person or some insight to someone. That's where it starts, is just initial communication. We have some issues that I really hope that a lot of the programs in the different organizations take a look at. One is really the lack of diversity as far as the Black population and other ethnicities in our profession. And so that's why PT Moves Me and other things are very important. The other is retention. Once we get minority kids into physical therapy school, they're flunking out at an alarming rate. And the same thing exists in medical schools, where we're comparing numbers with the National Medical Association. And the other thing that I hope we all collectively work on is support of our Black and other minority professors at different universities, because a lot of folks are having a hard time. And I think that those initiatives need to be a part of what our different organizations are considering as far as DEI initiatives. But just kind of engage and observe and share thoughts and be comfortable that you won't be judged where you are with things. You won't be judged where you are with things. I think nothing, I haven't seen any aggressive pushback from any of the organizations that are represented on this call for people that are new, that are just trying to find their footing with things.
Thank you so much, Rob. Appreciate that. I'm going to move on to Clarice.
Hi, thank you so much for having this meeting. I'm actually part of the Maryland board. I'm the director of community engagement, but I also at one point was helping out a lot with the mentorship part of the DEI. And I'm also one of the ambassadors for PT Move Me. And so my question is, as this, the DEI committee is starting with this section, are you all looking to do like committees within that? Like, how is it going to move forward? Because I know, like I said, and I think it's great that you also did get staff, because I know how that is, being on different committees, how that can be taxing when you're looking for volunteers to be able to do a lot of the work and finding the hands and the time to be able to do all the work. So I think it is great that you all have put the money and the efforts as far as getting staff to be able to help out with that. So my question is like, okay, so are they doing, because you said it's almost right now, it's just a committee of 2. And so as you're looking to expand and to get some of the strategic avenues of how you're going to move forward, what does that look like? And then just some thoughts that I've had within the orthopedic realm, you know, when we're looking to have more people specialize, right, and getting their OCS and doing residencies. I think sometimes when you're talking about underrepresented communities or marginalized communities, sometimes cost is an issue, right? And so when people are doing residencies, a lot of times they don't, you know, they might not be getting paid fully, like a full salary. So are they able to do that? Are they able to afford to be able to take an OCS exam or have the study materials or the resources to be able to do that? And then also for the AOPT is like, how much do we reach out to some of the maybe the HBCU programs that are in the country and helping them or seeing what the needs are for those programs in schools. And also within those schools, encouraging those students to furthering their skills by doing OCS, or taking their OCS or furthering their skills into doing residency programs. So I'm just wondering how much that we're reaching out to the schools on that level. And then also how are we planning to move forward as this, you know, this committee has started?
Yeah, and those are great questions, Clarice. Thanks. And a lot of those questions you have are the same questions we have because we're at the beginning of this process. You know, we know that we want to form a committee. We don't know what the shape of the committee is going to look like at this point, but I imagine that there'll be multiple, like at least 3 or 4 subcommittees underneath, and then at least that's what I envision, 3 or 4 subcommittees underneath the DEI heading, and under each of those heading subcommittees are opportunities for people to plug in to things that they have a passion about and demonstrate leadership and share their vision, because for us, everyone has a story and everyone has a voice. And so the more voices and the more stories we can hear and to help inform and shape the direction we go, the better. And so we want to provide opportunities for that. And so in the future, we'll be looking for volunteer help. We'll be potentially putting out calls for volunteers to help in this space as well. And the good thing is we have a staff person to help put us all together. You know, we always talk at the board that it's the staff that's the most important part of our academy. And for us, we'll have a staff person who's designated to help us get where we need to go. And so I'm thankful, Clarice, for those questions, and hopefully you can help us shape as we move forward, and you can be a part of the team that helped move this forward. So thank you for that.
Thanks, Derek. And thanks to Clarice for the question. Kim, go ahead. I see your hand up.
Yep. I just wanted to respond to Clarice's comments and thank her for making those comments because they're spot on. what was found in the summit. And the summit was really to take a more qualitative approach to identify what some of the, not just the barriers and challenges, but what's going on, what is the experience like. And I think that the AOPT committee should take a look at the proceedings. There's a lot of information in those proceedings that really identify, you know, what the issues are. So you don't really have to go back and look at it. But the other part of the proceedings is that there are groups that are still working to identify resources, to identify putting into place policies, to put into place identifying funding, federal funding, and things of that nature. So that work is ongoing. And one of the goals of the summit was to partner with you know, all the groups that are working out there. So we had, you know, all the PT groups from AAPT, you know, National Black PT Association, UGMA, all those groups were there, along with some of our professional colleagues that are working on the same issue, from veterinary medicine, dentistry, all of that. There is a lot of good information in there. And so the goal of the proceedings and looking at it, so you don't reinvent the wheel, you can identify and what's the issues are, but also to connect with those working groups. And Dawn, who is one of the team leaders, group leaders, is working on that. So I would suggest the committee look at the proceedings and gets, you know, some information from that, so you're not spending your dollars on kind of going and looking for the same information that's already out there. And the last thing I'll say is that one of the goals of the PT Fund, the Dimensions of Diversity Scholarship, is really to help components and groups to really develop either pathway programs or to support you know, faculty or students, but to work in partnership to really move the DEI initiative forward. So looking at some of the things that already been done out there, but looking at the Dimensions of Diversity funding, which I think that information will be posted soon. I think Carmon can probably answer that better than I, but that will be posted soon. And that's for anyone. That can be a program, that can be a component that's applying for those fundings and dollars to really move things along. So just to keep that in mind. And but I suggest everyone take a look at those proceedings.
Thank you so much for adding that, Kim. And thank you, Dawn, for your comment in the chat box and for giving us the link to the proceedings. So appreciate that. And I think we'll try and squeeze in one more. Sandra had her hand up, so that'll be the final question, but not to end the conversation. This is really the beginning for us. So please know that we're open and that we're interested in hearing more. So go ahead, Sandra.
Hi, thank you all for all of these ideas. Of course, it's got a lot spinning. Thank you, Dawn, for putting the address in, because that was one of my questions. So that got answered. I just had a couple of suggestions that are fairly concrete. I don't know if there's representation from the journal, but it might be nice to have the reviewers request that there be a full disclosure of who's in the sample for any studies that are published, so that we start to see who these studies are being conducted on, just as a way of having a little bit more understanding of where the research is applied. That would help us on the guideline side to be able to be a little bit more specific as well. And then I find I'm at Rutgers University. Our students, we have a very diverse class and have traditionally had diverse classes. They are more and more and more financially strapped. And even being a member of the APTA at the student level is something that they're choosing not to do for financial reasons. So if there's money to be had, either by the AOPT or by any of the other funds. I think having selective opportunities for students to apply for free memberships that are paid for by AOPT, and connecting them with a mentor to provide a little bit of dialogue and guidance along the way, and just encouragement, but a reason for why belonging is important. They can't do the residencies if they don't get through the program, and they can't become leaders if they don't have the role models. And there's a lot of folks that could connect. So be nice to see some financial support. I know the Research Academy, we don't charge student members. Perhaps there's a way to rethink whether the $15 student membership fee really needs to be at that level, and whether there's pathways for many more students to become involved that way.
Sandra, thank you so much for your suggestions. I'm going to go back to my and what I wanted to share was this contact information for our expert panel tonight. And actually, if you want to get in touch with Kim, you could go through the DEI at apta.org as well. And then in closing, I want to, provide a special thanks to our expert panel. Thank you so much for being here with us. We appreciate the sage words that you've shared with us, and so thankful that you've given up some of your time this evening to be here. Want to thank all the participants for your interest and commitment to this very important topic. And again, as I already stated, this is the beginning. This isn't the end of this conversation. So you'll be hearing much, much more from us as we move down our path, and look forward to collaborating with any of you who are interested. Just a final announcement, the next AOPT virtual town hall is going to be on Tuesday, September 5th at the same time, 7 p.m. Eastern time. And the topics to be determined. So not, we actually have a few ideas of some things that we think will be interesting for our members. And so we're just trying to fine tune that right now. So I'm going to close this evening. Thank you so much for everybody being here. Thanks to staff for all their efforts to logistics, getting this set up, and hope everybody has a wonderful evening and a blessed summer. Be safe out there. So, bye-bye.